The maternal mortality rate in Zimbabwe is 443 per 100,000 live births, while in the United States it is only 14. Good morning, my name is Lexi DeMarinins, and welcome to my TED Talk, The Absence of Mothers. A maternal mortality rate is when a mother dies, either giving birth or as a result of childbirth, and as I previously mentioned, this number is much higher in Zimbabwe than in the United States. So I wanted to look into why this is and what causes such a high maternal mortality rate and what can be done to reduce it. So this is a baby that was just born at Chidamoyo Christian Hospital in Zimbabwe, and this is an area that's very poor. There's not a lot of infrastructure. There's often food and fuel shortages, and anyone that is born into this area is born with a lack of opportunity just because of where they're born. So imagine this baby growing up without a mother because she died giving birth to them, and now they also have to face all this adversity. Once I realized this, I wanted to see what could be done to stop this. The two main causes of maternal death are hemorrhage and hypertension. Hemorrhage is excessive bleeding, and basically when the mother bleeds out and bleeds to death after childbirth, and hypertension is an excessively high blood pressure. These are things that can definitely occur in the United States, but they can easily be solved with the medicine that we have here and the training that we have here. So if we can do it in the United States, why can't we do it in Zimbabwe? The two main reasons are, like I just mentioned, training and supply access. A lot of the medical staff are not properly trained in Zimbabwe, and they just don't even have access to proper training. They don't know how to properly train, and oftentimes it can just be anyone that wants to help out in the hospital and help other people. So the second thing is supply access. While oftentimes people in the United States or other more developed countries will send supplies over to places like Zimbabwe and other third world countries, they often don't make it past the big city hospitals. And the big city hospitals already have lots of supplies, and oftentimes these supplies can even go to waste. They need to make it out to the more remote village hospitals, so they need to basically be sent directly to there. So I wanted to look into other countries that have had this issue and have had such a high maternal mortality rate and what they've done to try to reduce this. So Malawi is one of the countries that has one of the highest maternal mortality rates in the world, and they've done two things that are going to help to reduce their maternal mortality rate. The first thing that they've done is they've gathered the tribal chiefs and they've educated them on the importance of coming to the hospital for women to have their babies, because oftentimes they just have them at home because it's not part of their culture to participate in modern medicine or any medicine at all. And the second thing that they did is they set up waiting mothers shelters. And a waiting mothers shelter, like the one pictured here, this is one at Chidamoyo Christian Hospital in Zimbabwe, is a place where women come in the latter weeks of their pregnancy, and then this gets them there to the hospital before they even go into labor. So they're essentially forced to have their baby at the hospital, which is going to be much safer and much more sanitary. Now, while they're waiting at these shelters, they learn midwifery skills and they learn how to help themselves and help others with just women's health and also child labor. So this is a really positive program that gets people into the hospital as well as teaches them skills to help themselves and others outside of the hospital. So the next thing I wanted to do was look into why this is so important. Besides the fact that these children are going to grow up without a mother, why is that such a positive connection? Why is it so good to have that connection between yourself and your mother? So I watched a movie called Everyone's Child, and this is a story that takes place in Zimbabwe, and they live in a very poor village. It's a family of 4 children, and both of their parents died from AIDS, which is something that often occurs throughout many countries in Africa. So what happens is the oldest daughter turns to prostitution in order to get money and food and just general supplies to take care of her younger siblings, and the oldest brother goes into the city and he joins a gang so that he can earn money to help support his family. So obviously these are both really bad paths that both of these children have had to take because they don't have that support from their parents to help them and to guide them and support them. And the other people in the village that are older, they can't help either because they already don't have enough to even take care of their own families. So as a result of their parents dying, they've been led on the wrong path, and they now have even less opportunity than when they were originally born. The next thing I did was I read the book called Zinzeli, A Letter from My Daughter, and this also takes place in Africa. The mother grew up in a very poor village, and she was able to get out and move into the big city and make enough money to actually raise her children in a home that even had servants. But she's very grounded, and she wants to make sure that her children are still grounded and still value the African culture and don't just turn to modern ways. But her daughter wants to go to college at Harvard in the United States, and she's always questioned the Zimbabwean culture. She's always asked her mom why there's certain gender roles and why women have to do certain things and men have to do other things. And she questions it so much to the point where her mom actually begins to question it herself. But she wants to prepare her daughter for the racism that she's going to face in the United States and how it's going to be so much different than her own culture. And she wants to be able to help her daughter connect these two cultures and bring them into one without facing the least amount of adversity as she can. So again, without this mother's guidance, this daughter could go to the United States and just have no idea what to do because she wasn't prepared and she wasn't grounded in her own culture. So overall, the biggest thing is trying to get supplies over to Africa, and this isn't like really expensive things like x-ray machines or ultrasound machines and ultrasound fluid. It's really simple stuff like antibiotics and clean needles and IV bags and just even Advil stuff that we have plenty of and a ton of access to, so that we can keep these mother-child connections really strong. Thank you.